There's one day every year that's dedicated to showing solidarity with the millions of people around the world who have HIV and AIDS. It's also a time to remember those who have died from one of the most destructive pandemics in the history of mankind. December 1st is World AIDS Day, and this year's theme, Global Solidarity, Shared Responsibility. It's inspired by the challenges the world is faced with in this time of COVID-19. I'm Dr. Freddy Gomez. Welcome to MedTalk Health Talk, right here on CNN Philippines. We're seeing it firsthand and experiencing it, that in a pandemic, we all need to be in this together, much like HIV and AIDS. I'd like to welcome our guest for today, Dr. Rosana Ditanco. She's the head of the AIDS Research Group at the Research Institute for Tropical Medicine, or RITM. And also with us is Ronivin Pagtakhan, founder and executive director for Love Yourself Incorporated. Now, this year, we're faced with a COVID-19 pandemic which presents bigger challenges to anyone who needs medical attention, and that includes people with HIV and AIDS. Now, Dr. Annie, how are you able to care for patients who need to be treated for HIV and AIDS during this pandemic?
It's very challenging, especially during the ECQ, kasi yung mga pasyente ay they have to take their medicines and they have to get kailangan kukunin nila yung supply nila ng gamot, no, to sa mga treatment facilities nila. So ito yung malaking challenge. Pero na-anticipate na ito ng gobyerno at ng mga non-government organization. So nagpalabas ng policy ang DOH na kung ikaw ay na-trap doon sa kinalalagyan mong lugar, pwede kang kumuha ng gamot doon sa pinakamalapit na clinic or ospital na nagpo-provide ng treatment. So may libreng pagpapadala ng gamot, no? Kasi syempre mga iba nawala ng trabaho, yung mga ganyan. Yung mga telemedicine or telehealth, yun din ang ini-implement para kahit hindi sila makapunta, pwede silang magpakonsulta sa mga doktor.
Now, it was in the 80s and 90s that the AIDS outbreak impacted the United States and many parts of the world as well. But the disease was first detected decades earlier. Now, here in the Philippines, urgent action is desperately needed, and our country has the fastest growing number of HIV cases in the world. Now, Dr. Annie, please explain to us what's happening and who are the most vulnerable to this epidemic.
Ngayon, ang pinaka-talagang vulnerable or apektado yung mga kabataan kasi more than 60% ng mga bagong infection ay nangyayari sa mga kabataan, particularly yung mga nasa between 15 to 24 years old.
And that means the rate of increase in infections is one of the highest here in the Philippines. A UNAIDS report in 2018 found the Philippines was in fact #1 in the world. Dr. Annie, what are some of the reasons kung bakit tayo naging #1 sa paglaganap ng HIV at AIDS?
Kung titingnan natin yung bilang, hindi tayo ang pinakamarami, pero tayo yung pinakamabilis na tumaas ang bilang ng bagong infection. So yun ang medyo alarming kasi nga ang nagda-drive ngayon ng ating bagong mga infection ay mga kabataan. Kaya napaka-challenging ng pag-develop ng mga programa para mapigilan ang pagkalat ng HIV. Una, mga minor de edad pa sila, hindi nila pwedeng gawin ito on their own lamang. Kailangan may kasama pang magulang. Pero may mga policy naman na ginawa na para kahit bata ka pa or minor de edad ka pa, pwede ka na rin magpakonsulta, magpa-test at maaari na rin magpagamot.
One of the goals ng ating episode na ito is para maka-reach out or para maka-spread ng awareness with regards to this disease. Now, continuing still with kay Dr. Anya, could you share with us what happens to a person who is first infected with HIV and how long does it last before it becomes full-blown AIDS?
Depende sa lifestyle ng tao. Kung siya ay talagang maingat sa kanyang katawan, at practices a healthy lifestyle, it will take probably 5 to 8 years bago ka makaramdam ng mga simptomas na talagang sobrang hina na ng iyong immune system. Pero kung ikaw ay pabaya sa katawan mo, maaaring within 3 years lang, talagang bagsak na ang iyong immune system at magkakasakit ka na talaga ng mga infections na malala at magre-require na ikaw ay ma-admit or ma-confine sa ospital at kung hindi maagapan, ay maaari talagang ikamatay.
When we're talking about the immune system, we're talking about the T cell or a type of white blood cell which helps the body fight an infection. So your immune system is weakened when your T cells are under attack. And when a person is first infected, that's called the initial stage. Dr. Annie, what happens to a person in this stage of the infection?
After 2 weeks makapasok yung mikrobyo, ang nararamdaman lang ng tao, para lang siyang trinangkaso, nilagnat. Tapos after 1 to 2 weeks, wala ka nang mararamdaman. So, walang symptom. Hindi mo makikita, wala kang makikita sa itsura niya na siya pala ay meron ng HIV. Kasi asymptomatic tong stage na ito after nung sinabi kong mga 1 to 2 weeks na para kang tatrangkasuhin. And then, for so many years, ang pakiramdam mo, normal ka, ang itsura mo, normal.
And then, yes, that's true. No? So that's also one of the hard things when it comes to HIV. The next stage naman here is what is called the chronic HIV or yung asymptomatic HIV. Now, Dr. Annie, ano naman ang nangyayari sa stage na ito?
After getting infected, ito na yung tinatawag nating chronic stage of HIV. Na ganun pa rin, wala pa rin nararamdaman yung tao, pero sa loob ng kanyang katawan ay unti-unting humihina o nanghihina na yung immune system ng tao.
Now, I'll go to Vin. In terms of behaviors of Filipino patients, are we seeing people seeking medical help as soon as they find out that they're positive, that they're HIV positive?
Well, it's actually different from one person to the other, So the readiness is different. Some would immediately, some people have very good health-seeking behaviors versus some do not have health-seeking behaviors. So there would be clients who will be going to our community centers who are really asymptomatic, o kaya naman really health conscious lang sila, o kaya naman they just go for their routine testing every 3 months to 6 months, ganyan. And some would really go to our community centers with symptoms now.
Now, from the asymptomatic stage to the symptomatic HIV infection, that's our next stage, or yung tinatawag na stage 3, ano? So, Dr. Annie, as the name implies, a patient will now start experiencing mga simptomas. What are some of the more commonly felt symptoms, and what exactly is happening to their body at this point?
Okay. So, itong stage na to talagang medyo severe na, yung paghina ng kanyang immune system. Kaya malilitawan na siya ng mga infection or sakit na commonly hindi makikita kung malakas pa ang immune system. Sa Pilipinas, ang pinaka-common na unang manifestation na ikaw ay merong HIV at mahina ng immune system ay tuberculosis. Kasi unang-una, napaka-common din ng tuberculosis sa Pilipinas. Kaya lahat ng taong merong tuberculosis sa Pilipinas ay pinapatest namin for HIV. Ang iba pang manifestation, yung nagtatae, tapos nahuhulog yung katawan, or nilalagnat ng pabalik-balik.
Meron bang mga specific day-to-day routines ang mga HIV positive or activities na ginagawa nila who is in this stage of infection na dapat nilang gawin para ma-lessen ang kanilang symptoms or yung nararamdaman nila?
During the initial stage, nagkakaroon sila ng mga parang flu-like symptoms. Then after that, a person will not have any clue kung meron talaga silang HIV. So what we do is we encourage people who are sexually active to have themselves tested every 3 to 6 months.
Now, the risk factors, the treatments, and prevention of AIDS. We'll talk about all of those after a very short break. Please stay with us. You're watching MedTalk Health Talk, where your health comes first. HIV and AIDS chooses no one, young or old. Your sex and sexual orientation, they make no difference. But there are people who are at greater risk of HIV and AIDS. Can you lay these out for us and to our viewers, please? Who are those most susceptible talaga?
Primarily, it would be people who are exposing themselves to risky sexual behavior. So, ibig sabihin, example nun are people who go through or experience penetrative, unprotected sex. O kaya naman an infected mother to a child. O kaya naman people who inject needles and share needles. And then if you look at the Epidemiology Bureau's report ng cases of HIV here in the Philippines, majority talaga ng cases natin, around 80%, are MSM or yung tinatawag nating males having sex with males.
The first commercial blood test for HIV was in 1985. Now, Dr. Annie, how are people tested now?
Ang mga pagbabago kasi unang-una yung mga test nagiging mas sensitive. Dati hindi nito napipick up kapag hahawa mo pa lang ng HIV. Ngayon, as early as a few weeks after getting infected, madedetect na, no? Mapipick up na ng test na ikaw ay may HIV. Tapos ngayon din, meron na rin mga test na napakabilis ng resulta, yung tinatawag natin mga rapid test, na within 30 minutes, alam mo na kaagad yung resulta. Ngayon din, meron na rin tinatawag na mga self-testing na kung nahihiya kang pumunta sa mga laboratory or mga clinic, pwede mo rin i-test ang sarili mo. At pag nakita mong positive ka, and then pupunta ka ngayon sa clinic para magpagamot.
Napaka-importante malaman ng mga viewers natin yan that there are testing kits available. So, lahat ng klase kung gusto nyong pumunta sa isang institution or you can even do it at home. Ngayon, Dr. Annie, ano nang mangyayari ngayon na someone found himself or herself to be positive with HIV? Dito sa Pilipinas, what are the recommended procedures and treatments pagkatapos malaman na positive for HIV?
Ngayon, ang gusto nating mangyari ay pag nalaman ay agad-agad mag-umpisa na ng gamot. Kasi yan lang ang tanging paraan para mapigil yung paghina ng immune system at makontrol yung HIV sa katawan ng tao. Although ngayon talagang wala pang cure, na ibig sabihin wala pang gamot na pag ininom ng tao may HIV talagang mawawala yung HIV sa katawan niya. Wala pa noon, no? Pero ngayon, napakabisa naman ng mga gamot na kahit yung virus nasa katawan mo, hindi na nito kayang pahinain ang iyong immune system at yung taong may HIV ay maaaring mabuhay ng kasing haba at kasing normal ng isang taong walang HIV. Kaya yung early treatment napaka-importante noon kasi hangga't hindi ka nagagamot, hinahayaan mong manghina ang iyong immune system at kapag yan ay humina ng humina kahit uminom ka ng gamot, hindi yan talaga babalik sa dati, no? Kasing lakas ng dati. Kaya the earlier you treat, the better.
Okay. Napunta naman ako kay Vin ngayon. Vin, aside from getting medical help, are there any support groups to help with the mental well-being of a patient? Because this can be a very stressful event knowing that you're HIV positive, lalo na kapag kabataan ang frequently affected nito.
Yeah. First and foremost, since we're talking about testing kanina, I'd just like to let everyone know that there are many community centers available all over the Philippines. They just visit www.loveyourself.ph and click there, I want to get tested, and they will see all the free testing facility that offers HIV testing and STI testing. And once you get diagnosed, yung gamot rin, libre siya. Sabi nga ni Doc Annie kanina, it's a test and treat model. Ibig sabihin, once na-diagnose natin yung person, yung treatment is the same day rin. Love Yourself has a program called life coaching because we believe that HIV is not just a health issue, no? It's multifaceted, and when we provide intervention, kailangan holistic siya. So in Love Yourself, we have this program called counseling. So when a person is tested, meron siyang tinatawag na counselor. But when the person gets tested positive, nire-refer nung counselor si client kay life coach. Kasi ang goal natin is to promote resiliency and promote self-actualization and self-reliance. Kasi, di ba, syempre, when a person gets HIV, it's a lifetime of management. Di ba? Parang HIV is just like hypertension and diabetes. You can have it for the rest of your life. There's no cure right now, but there's treatment. Pero importante na may kaagapay ka. So this life coaches assist the client during the first 6 months ng journey ni client post-diagnosis until such time na maging stable na siya, maka-establish siya ng good treatment routine, nakakainom siya ng gamot ng maayos, mas nakaka-adjust na sa life niya. And then the life coach also promotes the idea of undetectable equals untransmittable, which means if you take your medications every day, normally after 6 months to 12 months, yung virus level sa dugo mo, ite-test yun through a test called viral load testing. It goes to an undetectable level, so hindi ka na nakakahawa.
We'd like to thank our guest for today, Dr. Rosana Ditanco from the Research Institute for Tropical Medicine, and Ronivin Pagtakhan, the founder of Love Yourself Incorporated. Thank you for your insights, explanations, and your knowledge about this deadly and prevalent disease. Now, the World Health Organization says there are some 38 million people who are living with HIV and AIDS, and we can understand how difficult it must be, not just physically, but emotionally and mentally as well. Coming up, we'll hear the story of one patient who knows this all too well. Welcome back to the program. I'm Dr. Freddy Gomez. December 1st is World AIDS Day, a special day dedicated to creating awareness about HIV and AIDS. And it's a time to remember those who are living with AIDS and those who have died from this disease. Joining us right now is Jonathan Gonzalez, or simply known as Jonats. Thank you so much, Jonats, for making the time and sharing your story with our viewers.
Thank you for having me today.
First and foremost, could you please share with us, when was the first time that you found out that you were HIV positive?
Actually, nung 2014 po ito, nag-join lang po ako sa grupo ng friends. No? Meron po kasi akong friend na founder po ng Love Yourself and kaka-establish pa lang po ng Love Yourself Anglo that time. So, nag-join lang po ako to support na parang, to show support na parang, sige, let's have ourselves tested. No? I mean, parang group activity siya. So, it was really shock po talaga, no? Parang to discover na, okay, so this intervention pala is actually for me, no? Ako pala yung magbe-benefit dito, no? Because I got to know my status.
When you found out you were HIV positive, what were the next steps, the next things that you did?
Well, internally po, of course, no, there's really, you have to have an internal discussion with yourself, no, parang how you're going to manage the diagnosis, how are you really accepting it, no, and then that may depend person to person, and then of course if as you slowly accept it, you re-engage with your healthcare providers, you talk with your doctor, you talk with your nurses, and let them guide you. No? Parang, for example, you take the first round of prophylaxis, preventive medicine. After that, you 2 weeks after, no, simulan mo na yung ARV mo talaga, which is the main medicine that manages HIV.
That's good that you mentioned that, yung medications or yung gamot na iniinom mo for HIV. Could you explain to our viewers, what's it like? What's your daily routine like, especially when taking the medications needed?
So, as a person living with HIV-1, no, parang meron kang responsibility to yourself na you take your medicine daily. It may vary from person to person kung ano po yung na-prescribe sa inyo ng inyong doktor. Sa akin po, umiinom ako 2 beses sa isang araw. Ang sa akin, pinili ko 10 a.m. sa umaga, 10 p.m. sa gabi. 2 pills kada inom. Pero what's common is lahat po ng PLHAV, umiinom po ng 3 combination po ng gamot right now sa kanilang daily regimen. So it helps keep po the viral load, yung level po ng HIV sa katawan namin na mababa, undetectable, such that na hindi po kami compromised, and we're also able to protect our partners.
Since nalaman mo na HIV positive ka, nagbago ka ba? Naging mas healthy ka ba with your kung anong kinakain mo? Mas maraming exercise bang ginagawa mo?
I started being flexitarian, parang flexible na vegetarian po. Hindi na po ako iinom ng cholesterol management medicines, so I'd rather change my diet na lang.
What's your best advice, Jonats, to our viewers right now when it comes to HIV awareness?
Really, it helps din siguro po na parang to see, to recognize that meron pa rin po talagang challenge ng stigma and discrimination pagdating po sa issue ng PLHAV. No, actually, parang kung isipin po natin, parang HIV po yung parang modern version ng leprosy, no? Yung ketong. Dahil meron pa rin nga pong ganong mga lingering issues, no? Parang akala po ng ibang tao na nakakahawa lang po siya basta-basta. So meron pong takot, no? Pero kung makikinig naman po tayo sa mga mga information na available sa dito sa ganito po mga show or kung meron po kayong personal na nakakilala, huwag po kayong matakot magtanong sa kanila. You will see na talagang it is just like any chronic disease or condition like diabetes, high blood, no? Meron lang po talaga kaming kailangan gawin on our end. It may be like yung taking your medications daily. Pero once you have achieved that, managed to acquire that habit, no, parang you can really move on with your life.
Thank you very much, Jonas, for sharing your story with us. Maraming salamat. We appreciate your time. Global solidarity, shared responsibility. That's this year's theme for World AIDS Day. But it does apply to this COVID-19 pandemic that we're up against. While there's this one day a year that's dedicated to calling attention to HIV and AIDS and to remember those who lost their lives to it, we can unite every day in the fight against one of the world's most serious public health challenges. I'm Dr. Freddy Gomez. Stay safe, everyone.